The Memorial Day weekend brought out big crowds to beaches and boardwalks across the country as states from coast to coast take steps toward reopening. Photos and videos of crowds taken over the weekend are prompting concerns about a resurgence of the virus. Video of a jam-packed pool party at Lake of the Ozarks in Missouri on Saturday showed hundreds of people blatantly ignoring signs to practice social distancing. It has prompted St. Louis County to issue a travel advisory, and the Kansas City health director is calling for all of the attendees, all of these people, to self-quarantine. And in Point Pleasant, New Jersey yesterday, a crowd of more than 200, many of them without masks, took part in a rally to reopen the state. Governor Phil Murphy later addressed the issue, insisting that his focus is on public safety.
You know, Willie, there's some of these shots that are obviously concerning. The one of the Ozarks is very concerning. I saw a shot of Panama City Beach where, it taken from the air, and it looked like people were actually distancing, socially distancing. Yeah. Also, people love to do the telephoto lens, like from an angle that makes it look like everybody's on top of each other. Sometimes the people that are, you can sort of sort through it, and you can see that they're clearly social distancing. So you look at the shot of Panama City Beach, and it looks, again, in many places, like the clusters of families there are actually separated. They're outside. It's hot. It's muggy. That's far different than, say, what we saw in the Ozarks. The thing is, I do understand when you're younger. There's the Ozarks video. I do understand when you're younger, you don't think that this is going to have an impact on you. If you look at the numbers suggest that the percentages are fairly low. But obviously, as Donald Trump's White House advisors and doctors have told Americans repeatedly, even young Americans who carry this asymptomatically can spread it to seniors, spread it to people in their 50s, spread it to even younger people that have underlying conditions. We have seen quite a few stories about people in their 30s and 40s and 50s dying. And so it is very dangerous and very reckless. So again, we hope this reopening is done responsibly. We hope people wear masks. We hope they socially distance, not just for the public health safety, not just to protect our seniors, but also to protect small business owners so they can keep their businesses open into the summer and into the fall.
Yeah, Joe, they're really pushing our buttons here. They had the Florida Panhandle with Panama City there. They had the Jersey Shore. I grew up in Jersey. And Lake of the Ozarks, where my dad grew up, working at the Arrowhead Lodge, and he just wrote a whole book about it. So those are our places. But I think it is important. Those are, on one level, obviously, those are disturbing scenes because of the impact of those people going back into their communities. But hopefully those are isolated. Hopefully those are small groups. I mean, when you look at the wide shot, again, of that rally in New Jersey, it was a couple of hundred people in Point Pleasant. So I think the important thing is you can't keep people inside forever. It's the summer. It was Memorial Day weekend.
Right.
People are going to go outside. They're going to go live their lives. They've been cooped up in their homes for 2 months. So how do we start doing that safely? And the only answer right now really is social distancing and those masks. And so not to put this back on President Trump, but a lot of people follow his lead. And if he wears that mask, I think it will send a signal to the people who we saw at that rally in New Jersey or on the beaches or in those pools to, at least, if you're going to go out, put on the mask to make it safe for other people. Joining us now, Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs. Dr. Sachs, good morning. Thanks for being with us. Just your impressions as a public health expert when you see a pool party like that in the Lake of the Ozarks, or you see crowded beaches or boardwalks at Coney Island.
Well, obviously, crowds like that are a big concern for us, and we particularly worry about crowds in the indoor setting. So we encourage people to get outside, but not outside in settings like that. I mean, if you notice, there were certain sections of the Ozarks parties that really weren't really outside at all, and people very, very close together. But overall, the message should be that outdoor is much safer than indoor, and that would apply to most of the shots that you just showed.
So, Dr. Sachs, as we look at the summer, as I mentioned, people are going to go outside. We're human beings. We've been indoors for 2 months. People want to go to the beach. They want to go to those boardwalks. They want to go to an outdoor bar. If that is going to happen and states are going to slowly reopen, there'll be conditions on how these restaurants and bars can open, how many people can be inside them, for example. What would be your recommendation to someone who said, you know what, this summer, I'm going outside. I'm taking my family outside. How should we proceed?
Well, I think it should be in small groups. Certainly with your family is safe. Certainly maybe with one or two other families, but not in large groups. What we clearly have learned over the past several weeks is that this epidemic is stimulated by what we call super spreader events, and they typically occur indoors by an individual who has the infection, sometimes pre-symptomatic or without symptoms.
Yeah.
And especially in settings where the area is very, very poorly ventilated. So outdoor activities in general are safer, and encourage those outdoor activities to be small scale.
Doctor, when you say that you could meet with 2 or 3 other families, that's clearly not what we were being told at the height of the lockdown, and yet we don't have medication for this, therapies for this, and we don't yet have a vaccine for this. What's changed from 2 months ago to today when you're saying it is safe to go and have a picnic in the park with a couple of other families?
Well, it's about maintaining some distance while you're having these activities. I don't think we can go directly from being completely shut down to being completely wide open. There has to be sort of a graded increase in our activities. It's just we have to move forward in a post-COVID environment. And as a result, we now understand much better how this is spread. It's spread by close contact with other individuals who have the infection, and that does not typically occur in outdoor settings. So if you can have a social interaction with another family where you're maintaining some distance, that would be considered a relatively safe activity. There's going to be no absolutes here.
Hey, doctor, this is Sam Stein. I want to ask you a bit of a devil's advocate question, because I know we've all had these conversations with either friends or relatives or have seen the conversation happen. But what do you say to people who say, look, you take risks whenever you go outside? It can be from getting in an automobile. It can be from getting the normal flu. You take risks when you stay inside. You can see depression spike. You can see instances of suicide spike. So we have to live our lives. We should go about doing it. And life is about risk taking. What do you say to those people who are using that rationalization to go out to the boardwalk or to the beach or to the swim up bar at the Lake of Ozarks?
Well, I would say that one should choose those activities with care. As I've already alluded to, outdoor activities such as going on a hike with your family, as I did with my family this past weekend, or going to meet another family and maintaining respectful social distancing with that family outdoors are both relatively safe. But I would not recommend that people return to crowded restaurants and bars right now. That is clearly not safe and not what we're recommending at all. But when people do compare to other risks, remember that these risks are not competing with each other. They're all there, and it's just something I think, have to start to internalize psychologically moving forward in a post-COVID world.
Dr. Sachs, when you look at these scenes and you see hundreds of people clustered together in pools, how possible is it that the virus is being spread?
So it would be the really close contacts, the way less than 6 feet kind of contacts that we're seeing in those pictures, and then those that are in areas where the ventilation is poor that we'd worry the most about. And remember that this virus doesn't start to cause symptoms for about average 4 to 6 days after it's acquired. And then sometimes takes a while for the illness to ramp up. So we won't really know whether events like this are causing spread of the virus for another several weeks.
Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs, thank you very much for coming on the show this morning. And coming up,
thanks for having me.
What are we doing to prevent the next 100,000 deaths? Peter Baker left readers with that question in his latest reporting for the New York Times. He joins the conversation just ahead on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.